Hello friends, welcome back. So the next question we will be doing is a practical question of research protocol. So what is the layout of a research protocol basically? So the question can be on any topic: suicide, CKD, RTA, leprosy, mobile addiction, etc. So we just have to see what is the flow of the research protocol. So first is the title: a cross-sectional study to assess the magnitude and determinants of adolescent suicide and distress dash. Okay, so like that we just have to change the topic. So the very first and foremost important thing will be our title. Then comes the background or introduction, brief about the disease or problem, which is which covers the burden globally, nationally and locally. Why is it important? Need for the study. Then talking about the justification, need of the study. Because it is high burden, there is a lack of local data, and if the study is done, it will help in planning interventions and policy making. Aim: to study the magnitude and determinants of adolescent suicide and district dash. So there will be the title and there will be an aim, okay, which is very much similar, but aim will be very specific. Like here it is given magnitude and determinants. Objectives: primary and secondary. Then research question: what is the prevalence and what are the determinants of adolescent suicide and district so and so. Study design: whether it is a cross-sectional study or whatever type of study it is. Study area: district dash, name of PHC, whatever area you are covering. Population: like adolescents aged 10 to 19 years residing in study area. Inclusion criteria: he or she should be resident, belonging to eligible age group, willing to give informed consent. Exclusion criteria: refusal to participate, seriously ill, or having an incomplete information. Sample size: there is a standard prevalence formula, so you have to calculate by that. Sampling technique: there is multi-stage random sampling, systemic random sampling, simple random sampling, any technique. Variables: dependent variables like adolescent suicide. Independent is age, sex, education, occupation, socioeconomic status, family history, addiction, mental illness, etc. This all data is necessary. Data collection: pre-tested or semi-structured questionnaire if there is already a standard questionnaire for it. Interview schedule या clinical examination. Data analysis: so mostly MS Excel or SPSS. Other is it's a movie software or any software which you are using, mention that. For descriptive stats, which has mean, percentage, proportion. Inferential stats, chi-square test. Association, odds ratio, relative risk. Ethical considerations: approval from IEC, informed written consent, confidentiality, right to withdraw from study, privacy and anonymity assured. Expected outcome: so what is the study going to give as an outcome? Magnitude of the problem, important determinants, help in planning appropriate interventions, improve adolescent health services. What are the limitations of this study? Cross-sectional study cannot establish causation. Recall bias हो सकता है, information bias, time and resource constraints. Okay, so and last is the reference, whatever reference you all are taking in Vancouver style. So there are 20 points for a research proposal. Title, intro, justification, aim, objectives, research questions, study design, area, population, inclusion criteria, exclusion criteria, sample size, sampling technique, variables, data collection, data analysis, ethical consideration, expected outcome, limitation, references. Okay. Steps in conducting a study: first you need to obtain an ethical approval, permission from the concerned authorities, selection of study area, sampling of participants, informed consent, data collection, data entry, data analysis, interpretation of results and reporting. Okay, this is a 10-step how to conduct a study. So marking scheme is given in the end. Like if it has asked for 20 marks, then what section covers what marks is given. So this is a basic idea of a research protocol. So any topic is given to you, this should be the flow. This is how you have to write it. Thank you.